Okay, welcome everyone to the clinical skills assessment for the class of 2024. This is a preparatory video for the Middletown and Harlem campuses. So we're going to go over some of the details of the assessment, as well as show you a sample OSCE that was recorded for you to help better prepare for everything in the upcoming days and weeks. Before I get there, I just wanted to mention that much of the information here has already been sent to you. So hopefully this is a bit of a review, just sort of summarized for ease and clarity. So as far as details of the assessment go, you will be rotating through 3 patient encounter rooms. Each encounter is a total of up to 14 minutes. This will include a 2-minute warning at the 12-minute mark. Of note, you can finish these encounters early. And if you do finish an encounter early, any additional time from your encounter can be used towards your post-encounter SOAP note. Following the encounter, you'll write a post-encounter SOAP note. More details on that later on the laptop outside of the exam room. You'll have 9 minutes to write this note. If you use the full 14 minutes, then you'll have the 9 minutes. If you end up finishing your encounter in 12 minutes, let's say, then you would have those 2 additional minutes to help write your SOAP note. You'll then rotate to the next room and so on until you've completed your 3 encounters. So as far as the cases go, these 3 encounters, these cases will represent those commonly seen in primary care and or emergency department settings. Of the 3 cases, 2 will be primary care cases, and 1 will be a so-called OMT case. For the OMT case, a standardized patient in the room will indicate to you that you are in an OMT case towards the conclusion of the physical exam. We'll give you some details on that in just a few minutes or so. Of note, our standardized patients don't have OMT performed on them, so we will be utilizing student volunteers to have OMT performed on them. So more details in just a couple of minutes about that. So what are the goals of this assessment? So this assessment provides basically an assessment of 6 fundamental clinical skills, as you can see here. So it's physician-patient communication, including the ability to communicate in the English language for each clinical encounter, interpersonal skills, professionalism, medical history taking and physical exam skills, your knowledge of osteopathic principles and osteopathic manipulative treatment, and then your documentation skills. And this includes the synthesis of clinical findings, your integrated differential diagnosis, and the formulation of a diagnostic and treatment plan in the format noted, which we'll discuss in a little bit. As far as the patient chart, so the patient chart, like most OSCEs, will be outside of the room. What you'll find in that patient chart when you open it up will be a doorway information sheet that will detail the identifying information of the patient, name and date of birth, their presenting problem, and their vital signs. Of note, you are not expected, or you should not repeat the vital signs. Assume them to be accurate. There will also be paper for you to take notes on, but please, of note, make sure you do take your paper out of the chart before moving on to the next room. There will be no prior history or visit to review. So essentially, you're going to see the patient information sheet. There will be a abbreviation sheet to help you with your SOAP note. I'm going to show you what that looks like in a little bit. And then there will be the blank sheets of paper for you to take your notes on. This is just a sample. Our doorway information sheets aren't going to look exactly like this, but just a sample. You can see the patient name, the clinical setting. So this is a family medicine office. It might be a emergency room, for example, and then it'll give you a presenting problem. So in this case, it's a neck pain. You can see the vital signs and some instructions on the bottom. So please take a look at that before you go into the room. As far as what you need to bring to the assessment, you should bring your stethoscope, something to write with, and a pen light. We are going to require you to wear KN95 masks as part of our OSCE lab policy, but we will provide those to you on the day of your OSCEs. So as far as the details of these encounters, these 3 encounters, these are going to be focused patient visits. So this means that your history taking should really focus on the presenting problem. So we're not expecting, nor do you have time to do a comprehensive patient visit, a comprehensive history, and a comprehensive physical exam. Realizing that you don't have a prior history to look at, that's the point of these being focused visits. So you should cover each aspect of the patient history, but you don't need to gather a detailed history for each section. For example, if we were to talk about family history, as you can see here, you should ask about overall for each patient, the health and well-being of their parents and any children. But then from there, you don't need to go into extensive details about siblings, grandparents, great-grandparents, and so on. But you might want to ask about relevant family history as it might pertain to the presenting problem the patient comes in with. For example, as you can see here, I have a patient presenting with a flank pain. So if you are thinking about flank pain, one of the things you might be thinking about is kidney stones. So in this case, you could ask the patient if there was a family history of kidney stones. Also, you don't need to take an extensive social history. As we've taught you before here at Toro, it's always good to ask about the core of drugs, tobacco, and alcohol, but otherwise keep your social history relevant. Ask a couple of questions that pertain to the presenting problem. We're not asking you to ask 10 to 15 different questions from social history, realizing that you don't have time to do all of that in the context of 14 minutes. So really keep it relevant to the presenting problem. To build on my example of flank pain, you could ask this patient about maybe their dietary intake and what their fluid intake is like. You should, however, gather details on any relevant past medical, surgical, and psychiatric history. So, asking the patient, do they have any underlying medical problems? Have they had any surgeries in the past? Have they had any psychiatric history? And then take a full history on medications and allergies. So you should be asking, for each section, do you take any prescription medications? And again, making sure that you detail how often, the dose, the route of administration, are they compliant? And then another category for over-the-counter and another category for vitamins and supplements. Same thing for allergies, asking for medication allergies, and then asking subsequently for food allergies and for environmental allergies. And again, if they indicate any of those, asking what the reactions are. Your review systems do not need to be full. Again, you're going to want to keep this relevant to the presenting problem. So we're not asking you to take a review of systems of 12 different systems where you're asking 4, 5, 6 different questions for each system. We want to keep this relevant to the presenting problem. So to use my same flank pain example, a relevant ROS here, thinking about what the differential might be, which could be, for example, pyelonephritis, could be a kidney stone, could be a UTI, could be some sort of mass potentially. You might ask about fever, chills, vomiting. I don't have this on here, but weight changes, dysuria, urgency, frequency. And that would be a pretty relevant review of systems for this case. So as you can see, you're going to be moving fairly quickly through the history, but making sure that you do hit all those relevant points as I just discussed. Again, moving on to the physical exam, you're not to repeat the vital signs. You do assume they are correct. So take note of those if anything looks abnormal to you. Physical exam should, again, be relevant to the presenting problem. So again, timing wise, we're not asking you to take a full physical exam from head to toe. You should be conducting elements of the physical exam that you think are relevant to the presenting problem. We will say that all patients should have a heart and lung exam. So that would be auscultation of the heart, auscultation of the lung in those key areas. Remember, correct position of the bed for those exams. And remember, listen on exposed skin, but also protecting patient modesty. So one of the things I'm going to ask you to do is I'm going to include with your information some guidelines on SP safety. So you are to review those before you come in for your OSCEs, just a refresher from your OSCEs from your first and second year. But remember, protecting patient modesty and comfort is of the utmost importance. Aside from the heart and lung exam, you should perform exam components that you deem relevant based on the presenting problem. So again, to build on my example of the patient with flank pain, you might additionally do on this patient an abdominal exam, maybe check for suprapubic tenderness and checking for CVA tenderness. There are some exceptions, and this is mostly due to COVID and just our SP restrictions in general. And as of now, we're not doing any mouth or nose exams, so the SP will leave their mask on for the entire visit, and then no middle ear exam or fundoscopic exam. So you can certainly examine the eyes with a pen light if you feel it to be relevant, but no close-up fundoscopic exam. And then you can examine the external ears, but no middle ear exam. So you're not going to grab an otoscope tip and put the otoscope in the ear. So what are the OMT cases going to look like when it comes to the physical exam and how they're going to progress? So what's going to happen is if you are in an OMT case, when you complete the heart and lung exam, the SP will hand you a findings card. So it's going to be a small findings card. And on that findings card is going to be detailed what you would find on this patient with this presenting complaint when you did an osteopathic structural exam. Obviously, these findings are hard to mimic in real life. So we're presenting to you what findings you might expect if a patient comes in with that presenting problem. When you watch the mock OSCE a little bit later, you'll see that that patient presented with a right fibular head dysfunction, and that's indicated in some language and some on the findings card. So then you'll use those findings to help you arrive at an OMT treatment plan for your patient. So you'll take a few seconds to kind of look over those findings, come up with a plan in your mind of what type of procedure or OMT treatment you'd like to do, and then you would move forward. The SP, in conjunction with handing you that findings card, is going to ask you a question: would OMT work for this? And again, that findings card and that question of would OMT work for this will tell you that that's an OMT visit. If you're not given that findings card and the SP doesn't say to you, would OMT work for this, assume that you're in a primary care case and you will not need to perform OMT in those cases. If you are in an OMT case, as you can see here, at that point, you should discuss your special training as an osteopathic medical student, how you can help them, and then ask if it's something they'd like to do, and then ask for permission to treat. At that point, the SP that's in the room, as I mentioned, will switch out of the room because they don't have OMT performed on them. We have student volunteers who will be waiting right outside the door. They'll come in, they'll sit on the exam table. You'll go ahead and briefly discuss what treatment modality you've chosen, the goals you hope to achieve. You'll make sure that you give the patient clear instructions on what you'd like them to do. When you see the example coming up in a little bit, you'll see that the student chose to use muscle energy. So the student gave some instructions on pushing against resistance for the patient. Of course, always when doing OMT, you're going to tell the patient to advise you if they feel uncomfortable. You're going to want to re-examine after your OMT treatment to confirm the treatment helped. And then ask the patient if they felt better. OMT treatment should not be more than 3 to 5 minutes of the visit. And in reality, it's probably going to be much less than that, especially if you choose a technique that moves a little bit quicker. Following completion of your OMT treatment, once you ask that patient if they feel better, and they indicate hopefully that they do feel better, they will swap out quickly. Your standardized patient or your patient will come back into the room, and then you'll move on to the completion of the visit, which is the assessment and plan. And again, you'll see what this looks like in the mock video that's coming up a little bit later. So what are some commonly used OMT techniques in these exams in the past? Muscle energy I mentioned already was used in the sample video. You'll see a little bit later. Counter strain, functional techniques, soft tissue, myofascial techniques, facilitated positional release. You can see still Spencer and Galbraith techniques, lymphatic pump, cranial, sinus drainage. Some of this will depend on the patient's presenting problem. So just make sure you think about, commonly used OMT techniques and common presentations when patients come in with, musculoskeletal problems, and make sure you have, 1 or 2 go-to techniques for each region of the body, so that when you're given that OMT findings card and that chief complaint, you'll have some idea of what technique you'd like to do. Again, as I mentioned earlier, remember with the physical exam to listen on exposed skin, but always protect patient modesty, so offering a drape. The drapes are in the second drawer of the exam room, just to give you a quick refresher on that. That's on the Middletown campus. Ask the patients if they feel comfortable. Let them know what you're doing, so that's important. So now I'm going to be listening to your heart, now I'm going to be listening to your lungs, now I'm going to be listening to your abdomen. Now the abdomen exam is not going to be for everybody necessarily, based on the chief complaint. Give them feedback on the exam. So that sounds good, that looks good, for example. Offer to help with position changes. So all very important techniques to protect patient safety and modesty. So when you hit that assessment and plan, you want to communicate to the patient what you think is the most likely diagnosis or diagnoses. Maybe there's a couple of things you're thinking about. So, indicate to them, I think this is what's going on. So I think you might have a kidney stone, but there's also a possibility that you might have an infection that's traveled to your kidney. So what I'd like to do for you today is to do some imaging, for example, a CAT scan of your back to look more closely at your kidneys, along with some lab work. So you're going to want to provide them with a proposed treatment plan. Make sure you use shared decision making. So provide them with what you think you'd like to do, and then ask them if it's something that they can do. Check for understanding. So make sure they understand everything that you've mentioned to them. Ask for questions. Ask for teach back. So ask them to repeat back what the plan is. So when you give them a plan, ask them to repeat that back to you. Make sure they understood everything. And then it's also important to ensure you cover areas outside of just medical decision making. So, for example, if somebody has a musculoskeletal complaint, maybe you want to ask if they would need a work note, for example, or something along those lines. So always consider those holistic factors in addition to the laboratory and imaging studies and medications. Okay, so once you've finished the encounter, you're going to wrap things up, conclude with the patient, let them know that, you hope they feel better soon and thank them for coming in. You'll step outside the room. The laptops are right outside the room. Um, and you will be sent login instructions for this so that you'll know what to do. Um, Make sure you review the samples provided to you in your email. This was sent in the preparatory information by either myself or Dr. Anthony on the Harlem campus. I actually have a screenshot of one on the next slide, I believe, so I'll show you that in a moment. There are 4 sections to fill data in on. So this is your typical SOAP notes, right? Subjective, objective, assessment, and plan. Again, remember, you only have 9 minutes. You might have more if you do end your encounter early. You might have more time, but at the least, you just have those 9 minutes. So make sure that if things are moving slow, if time's becoming short, try and fill in some data in each section. The assessment itself, this is maybe a little bit different than the way you write notes, but given the interest of time, we don't expect you to put a diagnosis or a differential and then explain why you think it's one thing versus the other. What we'd like you to do is to list a differential diagnosis of at least 3 items, 3 to 5 items, let's say, and use them in the order of most likely to least likely. So again, to use the example of flank pain that I've been using throughout this encounter, recording, an assessment might look something like this. So you think a kidney stone is the most likely possibility, but other possibilities include pyelonephritis, musculoskeletal strain, and a renal mass, which you doubt. So this is, from most likely to least likely. You want to have at least 3 items. That's very, very important. So 3 to 5 items on your differential. You don't need to do any more than that. Here's a sample of just a completed ESOP note. So just review this on your time, so you can see just quickly. Your subjective includes your HPI information, what makes it better, what makes it worse, things like that. Briefly, your relevant past medical surgical history, your medications and allergies, and then again your relevant family and social history. Again, not asking every single detail for each of these, but the basics and things that are possibly relevant to the presenting problem. Your objective would be your physical exam. Please make sure you include your vital signs in that. Vital signs are an important part of the note. Also include your general exam. So that's very important as well. So how does your patient generally look? Are they in any distress? Do they look well appearing? And then for your exam itself, make sure you don't just write normal. So what we don't want you to do is write heart normal, lungs normal, abdomen normal. We want you to document how you would document and what you've actually checked for. So for example, heart regular, rate, no murmurs, there's no S3, no S4, your lungs are clear to auscultation bilaterally, and so on. There's your assessment, again, listed as a bit of a differential diagnosis from most likely to least likely. And then there's your plan, which in this case includes OMT. In this case, this student had chose to do BLT, you can see, and then some medications, NSAIDs. You don't need to give doses. Category of medication is totally fine. So NSAIDs is appropriate. You don't need to say X number of milligrams. Just general class of medications is appropriate. Imaging if necessary, what you're looking for. And then, if you're worried about something that's more severe potentially, like in this case, you can see that there's an anginal equivalent along with a family history of heart disease. So maybe you want to rule out something bad, so that can't miss diagnosis. So you'd include that here, as you can see in EKG, to rule out ACS. This is a common abbreviations list. So this will be in your patient chart. And these are abbreviations that you can use in your SOAP note. So when you're writing your SOAP note, you can refer to these, and this makes things move a little bit quicker. So for example, as you're writing family history, instead of writing out family history, you can just write FH. Same thing, past medical PMH, past surgical PSH, review systems ROS. So this will keep things a lot easier for you and help things move a little bit faster in that 9 minutes that you have to write your note. Just some important considerations. Again, be specific, try to avoid using normal. Again, medication categories are fine. Dosages are not necessary. For labs, make sure you are specific. So, don't just say, I'm going to order some blood tests. Say you want to order serum electrolytes or a complete blood count, for example. Be sure to include follow-up recommendations. So follow up in 1 week or follow up in 1 month or follow up if symptoms worsen. And also think about how the symptoms may impact the patient's life. That's very, very important. And just to reiterate, each section is graded. So if you're running short on time, make sure you kind of fill in each section. So if you've done subjective and objective and you're writing the assessment and you're almost out of time, start writing a few things in the plan. serum electrolytes, X-ray of the chest, or something, whatever is relevant to the case, so that you have some parts filled out for each section, because that helps us know that you're thinking clinically relevant information here. These encounters will be graded on a pass-fail system. If a student fails, remediation will be necessary. Most often, this will include a meeting with one of the sort of course directors, which might include somebody from the primary care department, myself or Dr. Anthony, and then potentially, possibly, and or somebody from the OMM department on either campus. Exam retakes are possible depending on the outcomes of the remediation meetings, but generally don't happen too much, but they may be a possibility. So just keep that on the back burner. Checklists do look at both biomedical and humanistic factors. So it's very important, obviously, to hit those biomedical factors, and that includes things such as history taking and your medical decision making, but also the humanistic factors are important. And I'm going to follow up in a couple of minutes with more details on that. Your grades will be reported about 4 weeks following conclusion of the program. So you should look for grades at some point in sort of mid to late June or so. So again, the domains here are biomedical. You can see biomedical is your sort of data gathering, your osteopathic principles in OMT, and your SOAP note. And then your humanistic is your ability to elicit information, listening skills, giving information, respectfulness, empathy, and professionalism. And there's some more details on each slide coming up here. What are some history taking tips? So the ability to take history in a succinct manner, as I mentioned earlier, is really critical. You can try to use some mnemonics. So I know some people like to use the OPPQRST. So what you might want to do is when you take that patient chart before you go into the room, maybe you just want to write your mnemonic out before you go into the room, so to help you direct your questioning so that you can really stay on that focused history. Now, again, you don't need to follow that exact line of thinking, but be logical. Try not to avoid jumping around. Try to avoid jumping around from part to part. And again, not every detail will be relevant based on the chief complaint. So for example, one of the things we talk about is severity, grading pain from 0 to 10. Well, if somebody comes in with something that you really can't grade, for example, you can see here a cough, think about other ways, such as how it might impact the patient's life. So that's a good gauge of severity. Humanistic component tips allow for an opening statement from the patient. Use open-ended questions. So what brings you into the office today? And then you can transition as time goes on and as you get more information to more closed-ended questions. Make sure you use clear speech, focusing on appropriate tone, pace, and clarity. Use your continuers, paraphrasing, and echoing. Ensure that the patient is understanding you, that there's no language barrier. And you can ask the patient to summarize what you've told them, but also you can summarize what you've been told by the patient. So you can say, oh, I understand that you're coming in today with flank pain that's been going on for the past week or so. It's located on the right side. You've tried some Advil, which isn't helping, and you've noticed a little bit of blood in your urine today. Is that correct? So that's sort of summarizing information. Other tips, humanistic wise, active listening. So don't get caught up thinking about your next question. Pay attention. Demonstrate interest. So you can use statements such as, that must have been hard for you. I can see how you feel that way. Make sure you use transitions. You'll see in the video coming up, there's some really nice transitions. So now I'd like to ask you about your past medical history. Now I'd like to ask you about your past surgical history. Make sure to interrupt the patient. You can always paraphrase, as you can see there, and then using continuers. Speaking plain language, so you want to avoid using jargon. Again, shared decision-making, very important. Always communicate osteopathic principles in practice, even in the non-OMT visits. So, there will be patient, cases where maybe you're not going to do OMT, but you can always pull in those osteopathic principles, that holistic type approach to patients, which is very important. Summarize the visit in a manner understandable to the patient. Consider a teach back. So can you tell me what we discussed in regard to your cough or in regard to your back pain, for example, to use the flank pain example that I've been using. Ensure that all patient questions and concerns have been addressed, and then again, ensure appropriate follow-up. Being polite, asking for the patient's preferred title is always good. Using validation or empowerment. Asking for the patient perspective is always a good thing. So what do you think is going on? Or is there something specific you're worried about? Being collaborative, remembering that these visits are not one-way streets, using we rather than I, and then again, shared decision-making. Show interest in the patient, use that nonverbal body language, so facial expression, eye contact, posture, maybe leaning in a little bit, appropriate distance from the patient. You want to be sitting across the room. Apologize if you have if you evoke any discomfort during a physical exam, and explain why it's important. I do want to mention that if the patient indicates to you that they have some discomfort during the exam, saying ow or that hurts. So for example, if you have a patient with some sort of pain somewhere, usually that indicates that it's part of the case. Conversely, if a SP says to you, just a moment, doctor, that will indicate that you should stop and check in with them. Maybe you're pressing a little too hard or something along those lines. So remember that just a moment, doctor, that we've taught you earlier. We're still using that line. Remember that concerns often go beyond the actual medical problem. So it's important to, again, ask for impact on life. Be confident. So inspire the patient's trust. That builds a strong relationship. Dress professionally, ensure confidentiality, respect patient autonomy and privacy, and then make sure you have an appropriate closing statement and that you met the patient's needs today. Just some tips on opening and closing the encounter before I get to the mock video. So a crucial part of the visit is the opening of the encounter. It sets the tone for the visit. So we want to open the visit well. I will say it's often worthwhile to take maybe 15, 30 seconds outside of the room to take a look at the doorway information sheet, how old the patient is, what setting it's in, what that presenting problem is, and come up with a quick differential diagnosis. Write your template down, and then that'll really help shape your focused history taking in the room. Things to be mindful of: knocking, don't barge in. Make sure you close that door behind you, acting confident and professional, and then act concerned and caring. As you approach the patient, you can greet them using their name, establish their preferred title, introduce yourself, make sure you let them know your role, that you're a medical student. You can offer to shake hands, set an agenda, ask for permission to proceed. Make sure, again, you start with that open-ended question: what brings you into the office today? Offer validation for coming in. Offering empathy statements of the patient's coming in and has some sort of discomfort or pain, maybe including something like, I'm sorry to hear that. I'm going to help you feel better today, hopefully. Reminding the patient of confidentiality. Reminding them that you might be taking notes is a good idea, especially if you're somebody who it does write a lot or does look down and take a lot of notes. One thing I would say is, two things I would say is, you can tell them, I'm going to be taking some notes, but realize that my attention is squarely on you. And then B, you can also just say, you can also just make sure that you make eye contact with each question. So that's important as well. As far as closing the encounter, just some tips. This is a critical part of the visit, so be sure to budget enough time for that. So you want to get to the end of the physical exam before you get to your 2-minute warning. Have your differential ready from there, and from there, prepare your plan. You may have a lot to discuss and you might be a little bit nervous. So remember to sit down, maintain that good eye contact, and be confident. And remember, this is a partnership. So partner with the patient. Shared decision-making is very important. As you go through closing the encounter, check in with the patient, make sure they're understanding. Consider summarizing it. I would recommend teach back. So again, have the patient report back or repeat back what you told them. Check for understanding. Ensure all questions and concerns have been addressed. Ask, what questions do you have for me? So ask them, say to them, what questions do you have for me today? And if they don't have any, then you can thank them for coming in. Tell them if it's appropriate, you hope they feel better soon. And then you can go ahead and conclude your visit, step outside the room, and do your post-encounter SOAP note.